All right, today we're going to go way beyond the medical charts to really uncover the untold stories behind sickle cell. We're shining a light on the incredible human spirit that's just thriving against all odds. It's time to meet the real hidden heroes of this story. Let's get into it.
Just stop and really think about that for a second. What if that were you? We see the brave faces, we hear about clinic visits, but what about the silent struggles? The resilience that nobody sees? This isn't just some hypothetical question. For millions of people around the world, this is their daily reality.
And I promise you, by the time we're done with this explanator, you are going to see this condition in a completely new light. We're about to dive into the rarely discussed, deeply personal challenges and triumphs of living with sickle cell, and it's so much more than what you'd find in a textbook.
So, here's how we're going to do this. We're going to peel back the layers of the story together. We'll start with the diagnosis, the basics. Then we'll dig into the hidden financial and mental costs. And finally, we'll look at the incredible innovation and hope that's rising up from the community itself. Think of it like a giant iceberg. We're about to see what's really going on beneath the surface.
Okay, so let's start at the beginning with a part of the story that most people are at least a little familiar with, the medical diagnosis. This is just the very tip of that iceberg. So this is the core clinical reality, right? When you hear about sickle cell, this is usually what comes to mind. This intense, unpredictable, debilitating pain. It's a brutal physical experience that can put someone in the hospital with absolutely no warning.
And boom, this right here is the key. The crisis is real, it's severe, but it is only a tiny fraction of the full story. It's not even close to the whole picture. Can you imagine getting this diagnosis for your child? It's a moment of pure shock that just completely reshapes a family's entire world. And right from that moment, patients and their caregivers, they become these unseen heroes, learning to navigate a world that, let's be honest, often isn't built for someone with a chronic illness. All right, let's move to the next layer down. Now we're looking at the real-world consequences, the stuff that stretches way beyond the hospital walls and into every single corner of daily life. Now, what's so powerful here is how you can literally see the domino effect in action. This isn't just about medical bills, no. It's a parent losing wages because they have to care for a sick child. It's a student who misses so many school days that their entire future is affected. Families are constantly forced to make these impossible choices, like putting a career on hold to focus on treatment, and that creates these lasting cycles of hardship.
Now, we go deeper, way down to the part of the iceberg that is almost entirely submerged, the immense and often completely misunderstood psychological weight of it all. This contrast right here is so important to understand. On the outside, society might just see someone who seems to call in sick a lot, but the internal reality, it's a constant, grinding battle with pain, a deep-seated anxiety about when the next crisis will hit, and sometimes even dealing with skepticism from people who just don't get how serious an invisible illness can be.
Wow. This quote just says it all, doesn't it? The sheer mental fortitude it takes to face every single day knowing that agonizing pain could strike at any moment, it's just extraordinary. This isn't just about enduring something. It's about actively choosing to live with courage, day in and day out.
But here's the thing, this is not just a story of struggle. Not at all. Let's pivot now because there's an incredible story of empowerment, resilience, and real hope that is rising directly from within the sickle cell community itself.
So get this. The crucial point is that patients and their families aren't just waiting for solutions, they're creating them. Out of pure necessity, they become innovators, coming up with their own methods for managing pain in daily life. They become these tireless advocates, fighting for the recognition and research they so desperately deserve.
And you can really see the momentum building here. This progress is built on a foundation laid by community organizations who have been sounding the alarm for years. Today, we're seeing real legislative action, and looking ahead, incredible scientific advancements like gene therapy are offering something that was once so rare, genuine, tangible hope.
This brings us to our final and maybe the most important part of our whole discussion. We've seen the struggle. We've seen the incredible resilience. So now the question is, what's our role in all of this? Where do we fit in? Okay, this is step one. It's a huge mental shift. We have to stop thinking of sickle cell as some kind of niche or rare issue. It's not. It is a significant public health challenge that needs our collective attention and our resources.
So you might be asking, okay, what can I do? Well, these are real actionable steps you can take. You can volunteer your time.
You can use your voice to advocate for better policies, and maybe most importantly, you can just listen to the voices of the community and help amplify their stories. Because at the end of the day, this isn't about a disease, it's about people.
We've uncovered the hidden battles, the resilience, the hope. The story is no longer unseen. We've brought it out into the light. So the only question left is, what part will you play now? How will you show up for these unseen heroes?